Edification Hour, where information is power. And we have a special guest today who will be talking about women's health. And so we want to just continue to invite you to tune in. Please text somebody, call somebody, let them know we're going to be talking about something serious today, something vital, especially for those in our communities and in our demographic. So we want to welcome you to our program. With that, we're going to open with a word of prayer. Then I'm going to hand it over to our elder, Ian Francis. Let's pray. Father, we are so thankful for this awesome privilege of being here where we can be edified. And we pray as we receive the information that you may allow us to use it to grow. In Jesus' name, amen and amen. Thank you all once again. We welcome you to this program.
All right, I want to thank you again, Pastor Winter, for that kickoff. Guys, I want to welcome you once more again to our Edification Hour, where information is power. By now, you guys should have this little jingle down by memory, because this is truly an hour and a half, that we have put aside where we can be edified. Last week, we had Dr. Shama Williams, and the cardiologist, and he talked about hypertension, and we had such a great session. The week before that, we had Dr. Naomi Madas, and she talked about how we can maintain total health during COVID lockdown. The week before that, we had Dr. Lincoln Maines, urologist, and he talked about men's cancer screening when it comes to men. And before that, we had a joint program with our sister church, the Park Hill Seventh-day Adventist Church. And we had Dr. Aaron Burks, who was leading some panelists. And the main discussion was the COVID vaccine. So we have been getting a lot of great information. And today is no different. We have another special guest, someone that I've known for some time now. Her name is Dr. Paula Fox. Just to give you a little bit of introduction, Dr. Fox, she is a native of the Twin Island, Trinidad and Tobago. Beautiful island. If you guys haven't been there, you guys
have mercy.
You guys need to set a trip when COVID is over. But she's from the beautiful Twin Island, Trinidad and Tobago. She completed her undergraduate degree in education. She completed her undergraduate education as a biology major at the Morgan State University in Baltimore, Maryland. She then studied medicine at the Great Loma Linda University, after which she completed her residency in family medicine at the Riverside County Regional Medical Center in Moreno Valley, California. She also completed a course in alternative medicine at the Wildwood Lifestyle Center in Georgia. She now practices at Kaiser Permanente in Atlanta, Georgia, where she is the chief of family medicine. She's married to Dr. Curtis Fox, and they have 3 beautiful children. Guys, as I said, we are in for some good information today. If I'm gonna put it like this, we are in for some informational treat. Okay, so stay tuned. And remember, you have questions, you can ask a question either on Facebook or you can ask a question on YouTube, and those questions will be monitored and they will be answered. So without any further ado, at this time, I would like to turn it over to Dr. Paula Fox. Welcome, Dr. Fox.
Thank you, Ian, and it's a pleasure to be with you. I want to thank you for inviting me to be with you all this afternoon. It is my pleasure to share and to serve in this manner. I do consider it a privilege to educate my fellow brethren about things that are related to health, because I believe that's something that God wants us to do as Christian physicians. I thank you for having me this evening, and I'm gonna go ahead and share my screen, and I want you to let me know if you're able to see the content. And it's not allowing me to.
Oh, okay. I think let me fix that issue quickly.
Okay.
Um, I forgot to make you co-host.
That's okay. We're all getting used to this new normal that we're in, where we're doing several things via Zoom. Needless to
Exactly.
say, I am happy to be joining you all from Conyers, Georgia, which is where I currently reside. So good to be with you. I believe you're in Colorado, correct?
Yes, and it's very cold here today. As a matter of fact, it's around 1 degree right now.
Wow.
Yeah,
Wow.
yeah, and it's gonna get colder in the morning.
Okay.
So I'm
Wow.
a little
Well,
bit envious of you there right now in Atlanta.
we're around 40 degrees or so. So
Oh,
I
that's
guess we
great.
should be thankful for that. So praise God. I thank you for having me this evening. Uh, I will be focusing today on cancer screening, mostly for women, because I understand you did have Dr. Lincoln Maines, who was a good friend of mine and a
Yes.
urologist, and he was able to really hone in on cancer screening for men. So today I will be focusing mainly on cancer screening for women, but I will include some slides for men as well. And this will come from a primary care perspective. So, as all of you know, we are currently going through a major pandemic globally, and that has had some serious effects on our lives. One of which is many of us have changed the way we do business, and non essential things have been essentially cut out for a lot of people as they try to avoid contracting the COVID-19 pandemic. I will share with you that last year, close to this time when the pandemic first hit, one of the first things we did is we shut down the clinic to preventive visits. And most of our visits were being done online. That is still happening now, but we are slowly getting back into offering patients the opportunity to do their physical exams. So today, I want to stress how important it is that while we are going through this pandemic and doing the things we need to do to stay safe, that we do not neglect our cancer screenings and our routine physicals with our primary care doctors. All right, so I'll go through our overview of what I'll be touching on today, and I'll have some time for questions at the end. So I'll begin with a definition of screening and the difference between a screening exam and a diagnostic exam. Most of the time when you go in for your physicals, what we do are screening exams, not so much diagnostic, and I'll explain the difference. I'll move quickly on to cervical cancer screening. Then we'll touch on breast cancer screening, which is an area, it's a real passion of mine. We'll talk about colorectal cancer screening as relates to both men and women, a little bit on lung cancer screening, a touch on prostate cancer, and then we'll talk a bit about natural resources for fighting cancer. And I'll kind of have some of that in the middle of our talk. As we talk today, we'll talk about some of the natural resources and the way we can prevent cancer. All right, so let's talk about screening. What is the difference between a screening test and a diagnostic test? So basically, a screening test is one that is done to detect disease or a potential health disorder in people who do not have any symptoms. So you basically feel absolutely fine, you have no problems, you're just coming in for a routine physical, you feel great, but your doctor is offering you to do some screening tests. And you may or may not understand why they want to do these tests. Well, studies have shown that there are certain cancers and other diseases that can be detected early, that can be detected before we start showing signs of disease. And if we detect it early and we start treating it early, we are more likely to have a better outcome. So, for example, your doctor may order a blood test for you called the hemoglobin A1C. That is a test to look for diabetes. And you may or may not have any symptoms of diabetes, but when you get to a certain age, doctors want to start checking. So that's an example of a screening test. So today we'll be honing in on screening tests for cancer specifically. Now, a diagnostic test, as you can imagine, is one that is done to detect the cause of specific symptoms. So for example, you're going into your doctor and it's not just for a physical. You're probably going in, for example, for a headache. And it's the worst headache of your life. You've never had headache before, and your doctor is trying to do some evaluation. So they may order some tests, maybe some blood tests, maybe a head CT. What they're trying to do is find the cause of your symptom. and that is called a diagnostic test. So I think that difference is important because it has a lot to do with the test that we're going to be talking about today. So we'll start with cervical cancer screening. Now, cervical cancer is very, very common, although because of the pap smear, which is the main screening test for cervical cancer, we are able to catch these cancers very early and prevent many women from dying of cervical cancer. Now, let's talk about what exactly is the cervix. So on your right side here, you'll see a diagram of the female reproductive system. And what that shows is an example of what the uterus looks like, what the ovaries look like, what the fallopian tubes look like on either side. And just at the bottom of the uterus, right at the bottom, is the part we call the cervix. If you think about it, that's the part where when a woman's having a baby, the head pushes through the cervix in order for the child to come out of the uterus. And so the cervix is the bottom part of the uterus. And that is the part that we are honing in on when we do what's called a pap smear. So a pap smear is done to detect cervical cancer. Let's talk about some statistics. 2017 is the latest date for which we have statistics available. And I can tell you that back in 2017, we had about 12,831 new cases of cervical cancer. Unfortunately, we had 4,207 deaths from cervical cancer. What causes it? Studies have shown that this cancer is caused by a virus. It's actually a family of viruses known as HPV, which is short for human papilloma virus. So the human papilloma virus comes in many different strains and is actually a very common virus. As a matter of fact, many of us contract this virus from a very young age, and it's contracted simply by touch, simply by touch. Now, there are different strains of this virus. There are certain ones that cause warts, and these are just skin lesions that one can get on any part of the body. But certain strains of this virus can also cause cervical cancer. So one of the ways that we help to prevent cervical cancer is by offering the HPV vaccine at a very young age before one is exposed to this virus. So in general, and I'm a family physician, so I see children and adults. We offer the HPV vaccine starting at around the age of 11. Some start even earlier at 9, but definitely by the age of 11, parents want to consider vaccinating their kids against HPV or human papillomavirus. This can prevent them from developing cancer later on. And I just want to state here that HPV does not only cause cervical cancer. It can also cause cancer of the head and neck. It can also cause cancer of the anus as well as the penis in men. So it's a virus that is very common and can do a lot of damage. So by vaccinating your children, you can protect them later on from contracting these cancers. So in terms of cervical cancer, it can be caught early by the test called the pap smear. Now, when should women begin doing the pap smear? That's a very good question. About 5-10 years ago, the guidelines were different than they are now. So I'll just share with you the current guidelines. One should begin doing their pap smear at the age of 21. Okay, so every young woman at the age of 21 should be scheduling a physical exam and anticipating that she will start having a pap smear done. How often do you need to do it? So between the ages of 21 and 29, you would do your pap smear every 3 years as long as the test is normal, okay? If you're between the ages of 30 and 65, then you would do your pap smear every 5 years as long as it's normal. Now, what's the difference? Remember, I said HPV is very, very common. As a matter of fact, it's so common that 1 in every 2 women already have HPV, okay? So it's very common. So that's why in younger age groups, 21 to 29, they don't even bother checking for HPV. They just do the pap smear. And the pap smear is simply a test where we go in and take cells off the cervix. We send those cells to the lab, and the lab is able to look under the microscope and see if there's any cancerous cells or abnormal cells in the cervix. And so they're able to report that back to your physician, and they are able to guide you as to what to do. Now, in women 30 to 65, in addition to doing just the routine pap smear, where they take cells from the cervix, they also check for the HPV virus. So when you do your pap smear, if you're over 30, you should be getting two reports. One would tell you if there's any abnormal cells on your cervix. The other would tell you if you have the HPV virus or not. And depending on those results, your doctor will be able to guide you on what the next steps are. But like I said, if it's normal, it's once every 5 years. All right, I'm showing some images here because I am very visual, and I really want you to see something you probably would never see. This on your left is an example of a normal cervix. So when we go in vaginally with the speculum and look at the cervix, that's what the cervix should look like. Pink, healthy, no lesions or blemishes, nothing draining, just healthy looking. If you look on your right, you will see that this cervix looks completely abnormal. That is an example of a cervix where there's cancer. Now, women have no way of knowing if they have cervical cancer unless they do the pap smear. And so if you have not done yours and you're due, here is my shameless plug to ask you to please schedule your exam today. If no, well, not today, today's Sabbath, but Monday morning, you want to get on the phone or get on the computer, however you schedule with your doctor, and get your pap smear scheduled. Because the only way you will know is if you do the pap smear. You could have this cancer developing and not know it. But if you do the pap smear, you can detect it early when it can be treated. So before I move off of cervical cancer, I'll just say there are lots of ways to treat cervical cancer if it's detected early. Certainly they can freeze the cervix. They can electrically cut off the cancerous areas with a procedure called a LEAP. And they can go in and surgically just cut off the parts that are cancerous. So if it's caught early, it will not need to cause death. Moving right along to breast cancer. So breast cancer is the second most common cancer in the United States, second only to skin cancer, which is the most common cancer in the United States. In 2017, again, that's the year for which we have statistics available. We had 250,520 new cases of breast cancer in 2017. In that same year, we had 42,000 deaths from breast cancer. And I will just let you know that these statistics tend to look pretty much the same each year. And at the end, I'll show you where my sources are coming from, mainly from the CDC, the Centers for Disease Control. They collect this data for the entire country every year, and this is how we're able to get these statistics. But every year, about 40,000 women die from breast cancer, and about 250,000 women are diagnosed. It is very common. 1 in 8 women will be diagnosed with breast cancer in our lifetime. So it's something to be aware of, and it's something to check for when you go to do your physical exam with your doctor. I'll touch on men and breast cancer because sometimes we forget that men can also get breast cancer. Yes, it's most often found in women, but yes, one out of every 100 breast cancers in the United States is found in men. So that's about 1%. In 2021, the American Cancer Society predicts that about 2,650 men will be diagnosed and about 530 men will die from breast cancer. So this is something that everyone needs to pay attention to, whether you're a man or a woman. So what are some of the symptoms of breast cancer? Well, the most common symptom that most of us are aware of is a lump in the breast. So that lump could be in the breast or in the armpit region. So one of the things I tell patients is you definitely need to be familiar with your own breasts, and you want to check the area under the armpit as well for lumps. Other symptoms include thickening or swelling of part of the breast, irritation or dimpling of the skin of the breast, any redness or flaky skin of the nipple, pulling in of the nipple or pain in the nipple where you didn't have that before. If there's any nipple discharge other than breast milk, so if you see any blood coming out of the nipple or any strange color coming out of there, that's something you want to bring to your doctor's attention. Any change in the size or shape of the breast should also be a cause for concern. And also if you have any pain in the breast. Now, I do want to state that there are other conditions that can cause some of these same symptoms. So don't think that if you have any one of these symptoms that it absolutely means you have breast cancer. Let me give you an example. Pain in the breast. Pain in the breast can be caused from various things. If you're a breastfeeding mom, your breast may be engorged because they're full of milk. You can have pain in the breast from breastfeeding. If you can have an infection in the breast. So many breastfeeding moms might develop something called mastitis, which is a bacterial infection of the breast. It can cause redness, swelling, and pain in one part of the breast. That is also something that can cause pain. But one of the more common reasons we see women having pain in the breast is because of certain things they eat. So there are certain things in the diet that can cause us to have more pain in the breast. For example, caffeine, chocolate, soda, and fatty foods. All of these things can increase breast tenderness and pain in the breast. And then the other common one is just, the menstrual cycle. As women go through their cycle each month, they can develop pain in the breast as they get close to the period. So these are some things to bear in mind. So pain in the breast is very common and not necessarily a sign of cancer. But if it's something that's lasting a long time and you're not sure what's causing it, definitely see your doctor so that you can get it checked. What are some of the risk factors for breast cancer? Well, getting older. All of us, as we get older, and I'm talking about men and women, aging itself increases our risk for many cancers, and breast cancer is one of them. Genetic mutations. So you may have heard of the breast cancer gene. There's the BRCA1, BRCA2. These are breast cancer genes that run in families. And certainly if somebody in your family has tested positive for a breast cancer mutation, then that increases your risk of having a breast cancer mutation. And so that's also a very strong risk factor. Family history is also important, especially first degree relatives. So if your mother or sister has had breast cancer, that is something that elevates your risk for having breast cancer. Radiation treatment also increases your risk. Hormone treatment increases your risk. Women who took the drug diethylstilbestrol, known for short as DES, this was used back in the day for birth control and was later found to cause breast cancer, so it's no longer prescribed. Family history of breast or ovarian cancer is another risk factor. And then having dense breasts. And we'll talk a little bit more about dense breasts as I go along. So how do you reduce your risk for breast cancer? And I'm big on prevention, right? So here are some of the things that you can do, and they're very simple things that all of us can implement into our lives on a daily basis. One is to maintain a healthy weight. One of the risk factors that I did not mention on the previous page is obesity. If we are overweight or obese, our fat cells actually produce more estrogen, and increased estrogen exposure is a risk factor for developing breast cancer. So this is the reason why maintaining a healthy weight or a healthy BMI, body mass index, can decrease your risk for breast cancer. Exercise regularly. Yes, this helps to prevent every cancer. And how much exercise should we be getting? So certainly we recommend about 150 minutes of cardiovascular exercise each week. So I usually tell my patients, try to do 30 minutes, 5 days a week, something that you enjoy doing. It could be walking outside. Maybe you have some equipment in your house. You could simply just put on YouTube and find some exercise videos and dance along with it. So those are various ways that we can exercise, but you want to make sure that you're doing so on a regular basis because it does protect against cancer. Eating a plant-based diet. So certainly if you eat the colorful foods that the Lord has made for us, these foods contain natural antioxidants, natural cancer-fighting properties that will protect us against cancer. So a plant-based diet is certainly protective. And then genetic counseling, this is more so for those who do have the breast cancer gene present in the family. You may want to do some genetic counseling as they may have some special guidelines for you. So screening for breast cancer. Again, remember what I said in the beginning. Screening is where you're doing a test and you're mainly trying to catch it before symptoms develop. and you try to catch it before the cancer reaches an advanced stage. So monthly self-examinations used to be recommended in the past, not so much these days because they find that women do find some irregularities in the breast that turn out to not be cancer. So they tend to just cause a lot of anxiety and stress and ends up to be a benign lump. The annual clinical breast exam is a must. So this is where you go in to see your doctor once a year at least for your physical, and your doctor should be examining your breasts. There are specific things that I mentioned before that the doctor will look for, including lumps, skin changes, nipple drainage, disorders, anything that doesn't look right. And so your doctor will know how to check for these things. And lastly, a mammogram. So a mammogram is simply an x-ray of the breast, and the mammogram is one way that we can see and detect cancer early. And if it's detected early, then we can get rid of it so that it does not have to cause the end of one's life. Um, You'll hear about dense breasts, and many women, as they get their mammograms done, sometimes are told, you know what, you have dense breasts. So I just want to play this brief video for you, which will explain a little bit about what breast density is all about.
When you get the results of your mammogram, you may also get a note telling you that you have dense breasts. I'm Dr. Tamika Fairley. I'll explain what that means and why it's important. A woman's breast has 3 kinds of tissue: glandular tissue, which includes the part of the breast that makes milk, called the lobes, and the tubes that carry the milk to the nipple, called ducts; fibrous tissue, which holds the breast tissue in place; and fatty tissue, which fills the space between the fibrous tissue, lobes, and ducts. It gives the breast their size and shape. Breast density reflects the amount of fibrous and glandular tissue in a woman's breast compared to the amount of fatty tissue, as seen on a mammogram. In a mammography report, breast density is assigned to one of 4 categories. The breasts are almost entirely fatty. A few areas of dense tissue are scattered throughout the breast. The breasts are evenly dense throughout, or the breasts are extremely dense. Women in the first 2 categories are said to have fatty breast. Women in the second 2 categories are said to have dense breast. About half of women who are 40 or older have dense breast. Women with dense breast have a higher chance of getting breast cancer. The more dense your breasts are, the higher your risk. This mammogram shows a mostly fatty breast, and this mammogram shows a dense breast. Dense tissue can hide cancers. The fibrous and glandular tissue looks white on a mammogram, and so does a possible tumor. Since it's hard to tell the difference between a tumor and dense breast tissue, a small tumor may be missed. If you have dense breast, talk to your doctor about your risk of getting breast cancer. Dense breasts are just one of several risk factors for breast cancer. Your doctor will also consider other factors like your age and family history of cancer. Talk with your doctor about how often you should be screened and which tests are right for you. To learn more, visit cdc.gov/cancer.
All right. So certainly if you have dense breasts, you want to make sure you talk with your doctor about how, or if you need any additional testing, since the more dense your breasts are, the less likely we are to be able to detect the cancer. All right, wanted to touch a little bit on herbal remedies for breast cancer prevention. There are several natural remedies out there that can help to prevent as well as treat breast cancer. And what the table on your right shows is that there are several chemotherapeutic drugs that are used. But what's interesting is that a lot of these drugs come from plant sources. And what they're using in these drugs are the anti-cancer activity of the drugs. So it's very important to know that several drugs that are on the market are actually coming from plant sources. I also wanted to touch on some spices that if we currently use them in our diet can help to prevent cancer. and breast cancer in particular. So turmeric has been shown to inhibit the growth of cancer cells and is an anti-inflammatory spice. Ginger has antioxidant properties as well as anti-inflammatory properties. Ginger is also good for upset stomach and nausea. It can also help to stimulate appetite. Cayenne pepper contains something called capsaicin, which can help to decrease pain. It also contains other elements that can fight cancer. So cayenne pepper is the pepper to use if you're going to use pepper. Also want to talk about saffron, which contains something called crocins. And this is a water-soluble carotenoid that inhibits tumor growth and the progression of cancer. How about oregano? Oregano has antioxidant properties that also help to slow cancer growth and promotes something called apoptosis, which is cell death, meaning cancer cell death. It also has antibacterial properties and is a natural disinfectant. And then how about good old garlic? Garlic helps to boost the immune system, and it also decreases the growth of cancer cells. So if you don't already use these, here's my plug. Use these daily in your cooking. All right, let's move on to colon cancer screening. Here is another cancer that can affect both men and women. It refers to cancer that affects the colon or rectum. It is the third leading cause of cancer death in the United States. And again, this is a cancer that we should be thinking about when we go to our doctor for our yearly physicals. There are abnormal growths that can occur in the colon, which are called polyps. And over time, some polyps can turn into cancer. There are screening tests that can find polyps early so they can be removed before they turn into cancer. If you look at this picture on the the right, you'll see an example of what a polyp looks like. And this is what your colon looks like when you do one of the tests that I'm going to talk about, which is called a colonoscopy. So the colonoscopy is where we look directly inside the colon with a camera to see what the colon looks like, how the wall of the colon looks. And you can see how very small and inconspicuous this polyp looks right here. That's why when you do a colonoscopy, the doctor usually gives you something, it's called a prep, which you would drink to wash the colon out. And that is because we want the best visibility when we go in with the colonoscope and be able to not miss polyps like this. So if a polyp is found, they can take it out right then and there with something we call a biopsy, and they can tell you whether it's a cancerous polyp or a non-cancerous polyp. Finding polyps also directs your future follow-up treatment or follow-up studies, because if you have multiple polyps in your colon, you may want to do your colonoscopy in 3 years or 5 years versus 10 years. A normal colonoscopy is done once every 10 years. So what are some of the risk factors for colon cancer? Inflammatory bowel disease, also known as Crohn's disease or ulcerative colitis. These are some conditions that can increase your risk. Certainly, if you have a personal or family history of colon cancer, can also increase your risk. And then there are certain genetic syndromes where people develop multiple polyps in the colon. So, for example, familial adenomatous polyposis is one of them, and hereditary non-polyposis colorectal cancer. These are all genetic syndromes that increase your risk for colon cancer. Other risk factors, again, lifestyle-related things, lack of regular exercise, a diet that is low in fruits and vegetables, a low fiber diet and high fat diet, basically eating the foods, and I'm sorry I'm picking on McDonald's today, but this is an example of a diet that if you eat like that, your fries and your burgers and your soda, you're going to have a lot of health conditions. And one of them, they increase the risk for cancer, colon cancer nonetheless. A diet high in processed meats, again, being overweight or obese. Alcohol consumption is a risk factor here as well, and also tobacco use. What are some of the symptoms of colorectal cancer? Well, initially, you're not going to have any symptoms. If you have one of those little polyps that I showed earlier, you will not know that it's there until that polyp grows and then starts to cause symptoms. Some of the symptoms that will start happening, if it's caught later, blood in the stool or on the stool, stomach pain or cramps, and then unintentional weight loss. So you're losing weight, but you're not trying. That could be a sign of cancer. Colon cancer stages. So there are different stages for colon cancer as well as other cancers, and they usually go from stage 0 through stage 4. Stage 4 being the worst, where it means that the cancer has spread to surrounding organs and is at that point inoperable. So stage 1, the growth of the cancer is still within the walls of the colon. Stage 2, the tumor is pressing through the wall, but it has not yet spread to the surrounding lymph nodes. Stage 3, the cancer has spread to the lymph nodes. Stage 4, the cancer has spread to distant sites in the body, such as the liver or the lung, at which point it's considered inoperable because you cannot live without your liver. You certainly cannot live without your lungs. I show this famous actor here on the right who just passed away from colon cancer last year, just to make the point that we're seeing colon cancer now in younger people, and especially in the African American population. Colon cancer tends to be more aggressive, especially in the younger people. So when should you start screening? For high risk groups at age 45. And in general, if you're not in a high risk group, then you can start at age 50. But you definitely want to make sure you do some type of screening test. And again, the whole idea of screening is you want to catch it early when treatment can be done. So what are some of the screening tests? Stool tests, where we just check the stool for blood. These can be done annually. A flexible sigmoidoscopy. This is where the doctor goes in with a scope, much like you see on the picture on your right, and goes in about halfway up the colon, looking at that bend in the colon that's known as the sigmoid. It's one of the most common areas where cancer develops, but it's only half of the colon. So it's not as good as a colonoscopy, which looks at the entire colon. And that's the one that I highly, highly recommend, especially if you have members of your family with colon cancer. You want to just go ahead and get a colonoscopy because it is the best test. And then a CT colonography is also called a virtual colonoscopy. So that's where they give you a dye and they put you through the CT and they look at your colon that way. But the best test here, I would say, is your colonoscopy. So when should you screen for colon cancer? Again, for the general population, ages 50 to 75. For high-risk groups, such as African Americans and people with genetic mutations in the colon, start at age 45. You definitely want to know if you have someone in your family who has had colon cancer, find out how old they were when they were diagnosed. Because if they were young, like in their 40s, you want to start getting screened earlier than 45, okay? And then when you're over 75, it becomes an individual decision between you and your doctor, because then we have to talk about the benefits versus the risks of screening. So guidelines state that once you're over 75, have a chat with your doctor to see if it's worth doing it. Just one little blurb here on lung cancer screening. So lung cancer, I included it because it's one of the leading causes of cancer death in the US. The main risk factor is cigarette smoking, although we do have people who have never smoked cigarettes that still can get lung cancer. The only recommended screening test at this point is an annual low-dose CT in adults age 50 to 80 who have smoked at least for 20 years, 1 pack of cigarettes a day. So that's called a 20-pack year smoking history. If they currently smoke or if they have quit within the last 15 years. So these patients should be getting a CT, a low-dose CT of the lungs once a year, starting at the age of 50. And this picture on your right just shows what lung cancer can look like on an X-ray. It's an area of white where normally it should be much darker. Yes, prostate cancer. So I'm not going to spend a long time on this because I know you've already covered it with Dr. Maines a few weeks ago. But just to say, when you go to your screening exam, men, you want to make sure you talk to your doctor about prostate cancer screening. Prostate cancer over the years, the screening has changed. We no longer do the digital rectal exam to screen for prostate cancer. It's mainly a test called a PSA, prostate specific antigen. And I know Dr. Maines would have talked with you about it. When should you start screening? For, in general, 55 to 69, you definitely want to talk with your doctor about getting a PSA test. Talk with your doctor first. Why? Because doing the PSA brings some risk. The other reason is that the PSA test, also known as prostate specific antigen, can be elevated for other reasons besides prostate cancer. So if you have an enlarged prostate, or if you have an infection of the prostate, that can also cause your PSA to be elevated. So prostate cancer is not the only reason for it to be elevated. All right. So, and I just said this here, the different non-cancerous causes of a high PSA, certainly a urinary tract infection, and vigorous exercise can also do it. What are some of the symptoms? Difficulty starting urination, weak or interrupted flow of urine, frequent urination, especially at night, difficulty emptying the bladder completely, pain or burning during urination, blood in the urine or semen, pain in the back, hips, and pelvis that doesn't go away, and painful ejaculation. These are all symptoms of prostate cancer. So this is just to say that if your PSA is high, it's going to lead to them doing a prostate biopsy, which is where they take samples of your prostate. It can be very painful, can lead to blood in the semen and infection. And I'm not going to go into the therapies because I know Dr. Maines would have covered that, but I do want to touch on some foods that can help to prevent prostate cancer. So if you're a man, you want to make sure you're eating these regularly, and women too. But your tomatoes cooked is very helpful to protect against prostate cancer. Broccoli, cauliflower, legumes and soybeans, pomegranate juice, fish, bok choy, spinach, and kale. So notice it's mostly a plant-based diet. Just want to touch on a few herbal remedies that have helped people to maintain healthy prostates. You would hear about saw palmetto, which is a palm native to the southeastern United States. It actually reduces symptoms of an enlarged prostate. It also prevents hair loss, so men may use it as well for balding and other problems. It decreases inflammation and supports prostate health by regulating testosterone levels. Pumpkin seed extract is another natural remedy that helps to maintain a healthy prostate. It's high in antioxidants. It also is high in magnesium. And it also is good for the heart. And this is Heart Health Month, as you know. So this is one thing that you can add to your diet, and it really can help you in many ways. It also helps to lower blood sugar levels, and it's high in fiber. So that means it's also good for your colon. Zinc. So you hear a lot of talk these days about zinc, especially with the coronavirus going around. And that's because zinc helps the immune system. It really helps to boost the immune system. It also inhibits prostate cancer cells from growing. It helps with wound healing, blood clotting, and thyroid function. And it can be found in foods such as red meat, poultry, fish, nuts, legumes, and whole grains. It's available as a supplement. So just wrapping up with the sources that I got my information from, you'll see most of these came from the CDC website, cdc.gov. We also got some of it from the cancer.org website, as well as the US Preventive Services Task Force. So I believe that brings me to the end of my formal presentation. I'm going to stop sharing now and allow you to ask any questions.
All right. Wow. Such great information. So I have a few questions here. And the first one that I want to ask is, as far as where the herbal remedies are concerned, and the effectiveness on cancer in general, is there any data out there to support the herbal remedies? Sometimes, and this is what I have realized. So I may see on the internet, for example, great results and great uses of herbal remedies as it relates to various medical conditions. And I also like to double check that by going to WebMD, and it's a total different picture that WebMD presents, because I know they dwell heavily on data and things like that. So what is your perspective on the effectiveness as far as where that is concerned with herbal remedies in treatment of cancer?
Excellent question. So most of the data that we get on the herbal remedies comes from a database. It's called the Natural Medicine Database. And I don't know if you need a membership to it, but most physicians like myself, I have access to it through my company where I work. They actually provide it for all the doctors so that we can refer to it. And this is a website that gives you any data based on research that has been done on natural remedies, whether they're herbs, spices, whatever the food is that we're claiming that can do this particular thing. Whatever studies have been done on this particular herbal remedy would be found in this natural medicine database. And I believe you can look it up online. Just Google it, Natural Medicine Database. And that is where most physicians get their data from. You'll find that a lot of natural remedies, there's not a lot of studies behind many of it. And we rely heavily on research and experiments to prove, one, that the natural remedy works, two, that it's safe, three, that it does not interact with other natural remedies or other medications, and four, if it works, exactly how much of it should you be taking? Is there a certain quantity that might be too much? Believe it or not, certain natural remedies can actually be toxic if it's taken in high amounts. For example, nutmeg. You will hear about nutmeg. If you take high amounts of nutmeg, it actually can be a hallucinogen, can cause you to hallucinate.
Mercy.
Yes, so there are certain natural remedies that can be harmful. So you want to be careful and not just go taking things without checking. The other things that also important about this is there are certain natural remedies you do not want to mix with medicines. Let's see if I can give you a quick example. So you might have someone who is taking medicine for blood pressure, high blood pressure. You covered that recently. Well, garlic can also help to reduce blood pressure. So if you have someone who's taking medication to reduce their blood pressure, you want to be careful. If you're a naturalist and you're telling these people to go take some garlic or drink garlic tea, you want to be very careful to warn that person that their blood pressure might actually drop too low if they're combining it. So it's very important that we have the safety data and the interaction data on these natural foods, because some of them, they do actually work very well, but you have to know the data behind it, how much is safe, how much is too much, and what you can mix it with and what you cannot. But to answer your question, Ian, yes, Natural Medicine Database has a lot of that data.
Great.
I have a question as well. By the way, Doc, I think this is such awesome information. I've learned a few things today. One, I didn't know that man. I felt like I've been living under a rock. What man actually can get breast cancer? I was shocked. My jaw dropped. I was like, whoa, because you hear it so much about women. They have the women's breast cancer, day, and all these various things. And so I was just, wow, like I need to make sure I tighten up. So I got a question here. You mentioned that processed foods can be a leading cause of cancer. What about processed vegetarian food? Like the veggie meats, the Morning Stars, Beyond Burger, and all. Can those be a factor as well?
So I think what's important here is how the food is prepared. And yes, one of the things that leads to a lot of carcinogen formation is how the food is prepared. So if you grilling, for example, a burger, whether it's vegetarian or actual meat, you want to be careful because the grilling process, that high heat, can cause some carcinogen formation, and that can be lethal, whether it's meat or vegetarian. So you do want to be careful. A lot
Okay.
of vegetarian meats too tend to be high in sodium or salt. And so you just want to be careful if you're somebody who's dealing with high blood pressure or blood pressure issues, that you don't consume too many highly salted vegetarian meats. But that said, it is a good alternative for someone who's trying to get off meat, to start with vegetarian meats as an alternative, because they are plant-based. Many of them are coming from soy, which is of course a plant, bean. So if it's soy-based, it tends to be healthier, but you want to watch the salt content and the way that it's prepared. So in terms of preparation, baking is certainly healthy. Um, but grilling and frying, I mean, you're putting it in a lot of oil, so it's just as bad as, if you were dealing with actual meat. So you do have to be careful how you prepare it.
Okay.
Good question. All right. So another question here. So when you shared the data on cervical cancer, I think it says what 12,831 diagnoses in 2017 and 4,200 death. Um, you know, if that is encompasses of the entire United States, one may say, that's not very high. So I was just wondering, why is it is so low? Is it because of the vaccine, and perhaps this can be a push for vaccine? I don't know, but
Yes.
why is it so low?
Excellent question, Ian. So here's the thing. You are right. That is low compared to, say, breast cancer or prostate cancer or any of the others. And one of the reasons is, well, it's two things. One is, yes, the vaccine, the HPV vaccine that's now available. And we recommend it for people starting at a young age. So starting at 11, 12, your children should be getting vaccinated against HPV. Because by the time they become 18, 20, whatever, and they start interacting with others, they will contract HPV and not know it. And unfortunately, the first sign that they have it may be cancer. And so the HPV vaccine is big in prevention of this type of cancer. The other thing that's big is the pap smear. So now you cannot go to a doctor without them recommending, if you're a woman between the ages of 21 and 65, a pap smear is something that is very commonly offered and commonly done. And when we do a pap smear, we are able to detect a lot of cervical cancers in the early stages. So that's why you don't hear a lot about deaths from cervical cancer the way you do breast cancer, because we catch it so early, and there are many effective treatments available for early cervical cancer that it does not lead to lethality or death. We can freeze the cervix, we can cut the cancerous part off. There's something called the LEAP procedure, which they use basically a hot electrical knife and basically just cut off the cancerous part. So we have a lot of effective ways to treat cervical cancer if it is detected early. So yes, that's one of the reasons why the numbers are so low, and it's a testament to the advancements we've made both with vaccines and with the pap smear.
So would you recommend men, because you did mention that the HPV, that virus, it causes other cancers beside cervical cancer. So what about men or boys taking that vaccine? What's your question on that, tail on that, or spin?
Absolutely. So the vaccine is available for both boys and girls. It is not only for girls, and that is because the HPV virus can cause cancer in men as well. So it can
Right.
cause penile cancer, it can cause anal cancer, it can cause cancer of the head and neck. And you won't know until later on in life. So we usually see these cancers developing in men in their later years, but they may have contracted that HPV when they were much younger, because these viruses tend to start their dirty work and they cause problems, and it's very slow growing, the cancer. So that by the time you find it, you're like, okay, you're trying to figure out where it came from, but it may have come from years prior when you encountered that HPV virus. Because like I said, it's very common. So the answer is yes, boys as well as girls should be getting the HPV vaccine starting at the age of 11. If they get it before the age of 15, there's just 2 doses now. There used to be 3. So it's just 2 doses. Starting at age 11, you get your first one, and then 6 months later, you get the second one. If they're over 15, it is still 3 doses. And as a matter of fact, now they're recommending it all the way up to age 45. And that is a recent change within the last 2 years. So if you've never gotten the HPV vaccine as a child, you still can get it as an adult. The drawback is that by the time you're an adult, you probably have already encountered HPV or been infected with it, and you don't know. So, but if you've never gotten the vaccine, you should ask your doctor about it.
Question. So, being that I've seen a common trend with our last few speakers with some of these cancers being much higher among African Americans or blacks or however you want to put it. Should we then, in general, be testing for some of these things a lot earlier than our counterparts from different races?
Absolutely. And a lot of guidelines do state that, because they place African Americans as just being in a high risk group just because you're African American. And that is because a lot of the data, and I may have skipped over it in my slides, but for example, the data for prostate cancer, they have it broken down by race. And you can go to the CDC.gov website and you see the statistics, and you see where African Americans have a much higher rate of being diagnosed with prostate cancer, and many of them a higher death rate. The same thing occurs a little bit so with breast cancer. So you find that breast cancer incidence is equal in white women as it is in Black women, but mostly Black women are dying from breast cancer, or the death rate in African American women is higher than Caucasian women. And there are lots of studies being done to figure out, well, why is this happening? A lot of it is societal and economic issues, lack of access to care. socioeconomic status. So if you don't have insurance, you don't have access to a doctor, you're not getting these screening tests done. And you still can get the cancer, but you're going to find it at the point where you're having symptoms, which may be at a later stage. So you'd hear of people getting breast cancer or prostate cancer and it's stage 4. Well, what stage 4 means is that cancer has now spread to sites that are inoperable, namely the liver, and in some cases the brain. So you can't go and take the brain out. You can't take the liver out. You can't live without that. So it's called inoperable cancer. So that's why you find that people who don't get these screening tests done, they could still get the cancer, but they just get it found later on.
Wow. All right. I have another question here from our YouTube viewers. It says the human papillomavirus can be transferred from men to women and vice versa during intercourse, but how is it determined in time?
How is it determined in time?
Yes, that's yeah.
Okay. So yes, HPV is transmitted by touch. It's also transmitted by sexual activity. And so it can be going back and forth. Now, there is no HPV testing done in men, and that's very important to make clear. Because what's happening is this virus is so common that it's almost considered a waste of time to test for it. There is no test for it in men. And in young women, they don't test for it either because it is so common. And in most cases, it's not life-threatening. So I'll say that too. HPV virus is also responsible for common things like a wart on your finger. And that's one is not the STD one. That's just a common HPV strain that's transmitted by touch. But it can cause cancer. And so that's why, because there's no real screening test for HPV, what we recommend is to try to prevent it or allow your immune system to be able to fight it by getting the vaccine at a young age for both boys and girls. So getting vaccinated is your best protection. And then for women, once you turn 30, you should be getting HPV testing done along with your pap smear. Now, the HPV test they do in women at the age of 30 is not for all the different strains of HPV. Remember, viruses have different strains, so it's not just one type. Think of it as a virus family. So there are different strains that can cause cancer, HPV 16, HPV 18, HPV 55. So when they do the HPV test in women after the age of 30, they are looking for the cancer-causing strains of the HPV virus. What I'm trying to get at is, usually when they do these tests, they do them if the benefit of doing the test outweighs the risk of doing the test. And that is something that's important to talk about when we talk about screening. If you do a test and there's no benefit to that test, then that may be more harmful to you than beneficial. All right, what do I mean by that? So that's why we don't do mammograms in somebody who's 20. Why? Because when you do a mammogram, there is some risk. This is an X-ray. It does expose you to some amount of radiation, even though it's low, right? So there is some risk involved. But as women get older, remember, just by getting older, that's a risk factor in and of itself. So the benefit of getting the mammogram when you're older outweighs the potential risk of minor radiation that may happen. The other thing that's important to know is that mammograms are recommended at different intervals for different women. So on average, if there's no family history of breast cancer, you can do a mammogram every 2 years and you'll be fine. If there's a family history of breast cancer, then you want to do your mammograms once a year. And you probably want to start earlier if you have a direct family member who has had breast cancer. And I'll just add one more part to that. If, say, somebody has had a family member who had breast cancer at a young age, 50, 40 something, that person wants to start getting their mammograms 10 years earlier than the age at which their family member was diagnosed. So if the mother got it at 50, that young lady wants to start getting her mammograms at 40, right? Because there might be a genetic component, and the earlier she starts checking, the better. And the same goes for colon cancer and prostate cancer as well.
Wow, such good information. Okay, I have another question here. So you talked about early detection in colon cancer. Um, how effective is colon cancer treatment? Assuming is detected fairly early.
Yes, it is very effective if it's detected early. As a matter of fact, remember I showed you that slide with the 4 stages, stage 1,
Yes.
2, 4.
Mm-hmm.
So stage 1 is just that little polyp. It's within the wall. It's like the little polyp. So it's still just in the wall of the colon. So literally when they go in with the colonoscope and they see that polyp, they're going to take it out. Now they're going to send that polyp to the pathologist who's going to look at it under the microscope to determine what kind of cells they are. And that's who will tell us if these are cancerous cells or benign or non-cancerous cells. So if it's cancerous cells, guess what? Just by taking that polyp out, you just got rid of that cancer. If it's a stage 1. Now, if it's at stage 2 or 3, where now it's spread outside of the colon, you're looking at more aggressive treatment. So if it's stage 3 or whatever, then you have to actually cut more area. You have to cut the entire area that's affected as well as anything else that's affected. So you're looking at probably colon surgery, like a colectomy, where they actually have to cut, piece, and rejoin. And then if it's spread beyond that, you may need chemotherapy and other therapies. So the moral of the story is, the earlier the cancer is detected, the easier it is to treat. And so that's the benefit of doing screening.
You know, I feel this is so amazing. When you look at society today, mostly what is advertised as I'm listening to these presentations are cancer causing things. Alcohol, widely circulated, right? Bud Light commercials. I mean, they pay millions of dollars for Super Bowl time, right? Or just in general, fast foods. So popularly, so popular in, especially in our communities, right? McDonald's, Burger Kings, and these various things, and you see that, man, all these things lead to cancer. I do find it interesting that a lot of these places, though, are also in lower um, income communities, right? And so maybe there is some correlation between why African Americans or people below the poverty line. It's because of all those things that's available and around them as well. But it does definitely just shows us, man, that we have to be careful in what we put in our bodies and truly be intentional about eating right, because it definitely pays off in the long run.
Absolutely. And that's why
All right.
programs,
So I have another. Sorry, guy.
Hold on, Ian.
yeah, I was just going to say that's why these kinds of programs, I love doing them, because I think by educating our communities, just by bringing that awareness, you can get people to change their behavior and make better choices, and they can definitely live longer lives.
All right. So another question came in here. It says, can calcification in the breast cause cancer? Should you stop getting a pap smear after age 65 if no history of cancer? If so, how do you detect other diseases in that area by symptoms you may experience? And I can repeat it if you want me in different segments, since there are several questions in here.
Yes, yes. And I'm tagging on to the last part of it. So after 65, it's an individual decision between you and your doctor. And so a lot, and again, it goes, I don't want to get too technical, but a lot of these tests that we do, we know that, okay, we can detect cancer through it. And so if you're 75 years old and you're as healthy as, say, a 35-year-old, and your life expectancy is maybe 100, right? By all means, you can continue to do your pap smears, because your life expectancy is such that it would be beneficial to you to continue screening. Because the whole idea of screening is that you want to detect something early, at which point, if we need to intervene, it's going to add years to your life. Now, if you have someone who is older than 65, who is already battling several major life-threatening conditions, then they may not want to do anything too invasive that may involve surgery and other kinds of interventions, which can carry risk along with them. So that's where an individual decision is what we use to determine whether or not one should continue after the age of 65. So it's not that you stop after 65, it's just the guidelines are stating that this is the age range where it's beneficial to screen. The other thing is that if you're over 65 and you're having symptoms, so all of a sudden you're having pelvic pain, or you're having, bleeding, or whatever it is, you want to get that checked. Now, the test that will be done is no longer a screening test. It is now a diagnostic test. Because remember, in the beginning, I stated there's a difference. So you still would do a diagnostic test to figure out what's causing that symptom, no matter the age. But in terms of screening, which is where you do a test before any symptoms are found, that's where that age group matters. And that's because the benefit in that age group overrides or is higher than the risks of the test itself.
What about the first part? So the question, she also asks, what about calcification of the breast? Does
Yes.
that?
Yes, so calcification, that's a very important question because calcification on a mammogram may be a sign of cancer. And remember when we were talking about dense breasts, the lady stated that, okay, on a mammogram, in women with high density breasts, the mammogram, a lot of the tissue shows up white. Well, calcification also shows up white on breast tissue. So, and calcification can be a sign of cancer. So if you're doing a mammogram on a woman with dense breasts, you might miss a cancer on that woman. And so if you get the report back that you have dense breasts, you want to have a conversation with your doctor as to whether you need to do some additional testing, like maybe a 3D mammogram as opposed to a 2D mammogram, or an ultrasound, or an MRI. So there are other tests that are done in women with dense breasts. But calcification is a sign of breast cancer.
All right. So another question here. What about polyps in the appendix?
The appendix, oh dear. So the appendix is kind of its own little appendage, if you will. And so we really don't look inside of it so much. But certainly any polyp is concerning. So if a polyp is found, it should be biopsied. It should be checked to see if it's benign or cancerous, wherever it is.
Okay. So earlier you mentioned several types of tests for colon cancer, just to make sure, you know, everything's fine. You said colonoscopy was the best, you know, to do that. What about for Black men and well, Black people, sorry, because this cancer is in both. So as
Yes.
far as where Black people are concerned, as you know, assuming that it's not in your lineage, your hereditary or anything like that, would you still recommend the colonoscopy rather than a stool test or something like that?
Absolutely, yes. So the colonoscopy is the best test. And I say that because it's a direct look inside of the colon. The other test, the fecal globin test, which is where we check the stool for blood, is a little more indirect. So we're checking to see if you're having any minute bleeding that you can't really see with the naked eye. And then if they find blood in the stool, they're going to send you for a colonoscopy anyway. That's the next step. So I tell my patients, it's better you just get the colonoscopy.
Mm.
It's once every 10 years, starting at the age of 50 for most people. But if you're African American, you should start at the age of 45. Start getting your colonoscopy. If it's normal, you're good for 10 years. Why? Because they looked at your entire colon, provided you did the prep well. Now, there's some people who don't follow the guidelines on the prep. That's a whole nother story, because if you don't clean out the colon, they're going to miss certain areas. So it's very important that you do the prep well. You drink, there's like a gallon of something called Go Lightly that is commonly used the day before your colonoscopy. And you're supposed to drink that in certain intervals. Well, that just flushes out the entire colon and allows the gastroenterologist to see the wall of the colon very well. And if they see any polyps, they take it out right then and there. So if it's someone in my family or for myself, I'll be doing the colonoscopy over anything else. But if all you have access to is the fecal globin test, which is where they check the stool for blood, then do that. So do something is my bottom line. Not checking is really setting yourself at a disadvantage.
All right. So this information is really good.
Mhm.
And as you were presenting, you know, my mind just, you know, keep going back on underserved communities. You know, we've heard lots of information on that, especially with this vaccine. You know, time after time, we've heard, well, certain people are not getting vaccinated, you know, right now. So I was for the COVID vaccine. And why is it these communities are not being reached? I don't know. Is there a best practice or some recommendation, you know, that you can share, and how you can, or the most effective way in reaching these underserved communities, especially communities of African American, Hispanics, whatever it is? I mean, how can how can we get that information out there? I mean, I don't know if there's a best practice. I know that you in the Atlanta area, lots of minority folks. I was just wondering if there's some best practice that we can just, jump on to help with this population.
Absolutely. So for societies in the minority population, the big issue is trust. There is a lot of reasons why many of them distrust the healthcare system, right? So trust is a big one. So one best practice is that you have to meet them where they are, number one.
Hmm.
So where are they? If you think in terms of African Americans, people like you and me, a lot of them are in church. And so doing programs like this and making sure that people
Right.
see them, that is one way. The other is making sure that the person presenting is someone they know and trust. So giving my background or the background of whoever the presenter is lends credibility to what they're saying. So for, say example, if it's an Adventist church, if you have an Adventist physician presenting, they're more likely to listen to that person than if you bring a non-Adventist in, right? Same thing, if you have African Americans mostly and you bring an African American physician to speak, they're more likely to listen than if it's a physician of another persuasion.
Right.
So meeting them where they are, having the presenter be someone that has credibility and who they trust, that also matters. And by meeting them where they are, so the church is one place. Other places are, for example, the barber shop. If you can partner, and this is something that churches can do, you partner with your local barber shop to offer services or even just show like a televised program at the barber shop while people are sitting waiting to get their hair done. These things educate these communities and help them to at least start talking about it. Because awareness is what allows people to know, listen, I need to do something or I need to change something. We need to first make them aware. So partnering with the communities where they are at and making sure that somebody who's a trusted figure is the one giving the message is very important.
Very good. Well, I don't see any more questions coming through here. Um, any questions, Pastor?
I'm just blown away. I'm trying to take it all in. This has been so enriching, seriously. Just thinking about some of the things that, even the list that you gave with some of the foods that can help to prevent cancers, I think it's so amazing. I'm hoping we can get some of the presentation we could circulate to some of our members, because this is such good information. I just want to thank you for coming. I don't have any questions at this time, but it truly was a blessing.
Thank you. My
Right.
pleasure. That presentation to you, Ian.
Okay, that'd be great. That'd be great, because I was gonna ask if you could get that as well. Lots of great information. So, Dr. Fox, again, on behalf of the new community and Boston Street Seventh Adventist Church, I want to thank you so much for coming on and edifying us with such great information. As a community, I know it's Black History Month, so I'm going to focus a little bit on us, but as a community of Black folks, we really need this information. And if it's one thing I have realized throughout our presentation, is the outliers are always the Black folks. Mm-hmm. Always. And I was like, oh my goodness, is there anything, that we stand above the other races with? But, it's really good. So this information was right on time. It is pertinent. And again, I really want to thank you. So at this time, we're going to sign off. Guys on Facebook and YouTube, want to thank you for those questions. And of course, you can go back and look at the video. So at this time, I want to thank you again, Dr. Fox.
Thank you for having me.